Hi, I'm Ziba Mercer with Accelerize, and welcome to our next video on Hipaa. Today we're going to really focus on security and privacy. Really, security and privacy focuses around meaningful use and meaningful use compliance. So what does privacy security really entail? From a 30,000 view, it really focuses on three different things. One, patient access to their records. Two, their privacy on the information of the patient at records. And three, keeping those individual records secure and safe. So let's take a look at meaningful use stages on privacy and security. So there are really two specific measures related to privacy and security. This is measure 12 and measure 15. 12 really focuses on providing patients with electronic copy upon request. So what is the requirement for meaningful use? Over 50% of your patients must be provided with an electronic copy of records within 3 business days. Measure 15 is really talking about protecting the electronic health information by a certified electronic health record. What is the requirement for this? You need to perform and conduct a review of your security, have some form of security risk analysis and risk mitigation management process. So with this, measure 12, measure 15 are the two components of meaningful use for privacy and security. Measure 12 really focuses on both electronic health record, both paper and electronic. With measure 15, it really focuses on how to mitigate your risk for protecting and storing your patient records. So with this, let's look at how we can comply with meaningful use and how to do a risk assessment. With the security risk analysis process, you really want to look at your existing security and protected health information policies and procedures. You want to identify any threats and vulnerability. You want to assess for likelihood for impact, mitigate security risk, and monitor your results. So for example, when you're looking at security vulnerability, it could be as simple as user access control, or maybe even theft of portable devices that has patient information. You're going to look at each one of those areas and say, what can I do to correct those measures? Do I need changes to workflow, new updated policies and procedures, or just staff training? I can't stress the importance of document, document, document. Now, have a checklist. There's so many things that needs to go into the centralized repository. Everything from staff training documentation, certifications, policies and procedures, a checklist of all your vendors and business associate agreements, all your training documentation, all your policies and procedures for your PCs, your network. Everything you can think of that's concerning about HIPAA and security should be in the centralized documentation place. And so there are other areas that you really want to focus on, and that is all your control access for your organization, which includes even audit logs of who accessed which patient information and what. So let me talk a little bit about the training for your staff and what is the key things that your staff needs to know about HIPAA, security, and privacy. Here's a few that could just be part of your training. Never view patient records outside required scope of work. Keep PHI secured, and do not discuss PHI in public areas, which includes hallways and elevators. PHI on social media is actually considered a total breach. Electronic access. Never share ID or passwords. Log off the PC when they walk away. Next is really having your staff understand what does PHI consist of. It's not just social security numbers. It includes names and addresses, telephone and fax numbers, email addresses, medical records numbers, dates, which includes date of birth, death, admission, discharge, full face photos, and any comparable images of patients. Next, you want to consider shredding all PHI documentation, which includes labels on pill bottles and faxes with no PHI cover sheets. The key is to understand what is truly a breach. A breach is defined as unauthorized acquisition, access, or disclosure of PHI information. And there are several things that could fall into this category. Everything from viewing patient information when you're not supposed to, throwing PHI in a trash bin and not having it shred, giving discharge information to maybe a wrong patient or a prescription to a wrong patient, and that's why having 2 patient identifiers are so important. Posting patient information on general areas. Did you know that sending a fax without a cover sheet may be considered a breach? Because if you think about it, that fax may go to a wrong recipient who should not be getting that patient information. So always remember to send a cover letter with your fax sheets. The main thing is to keep your organization protected. Have only people who need to access that information be able to get that information for the patient. And also, continue to provide policy and procedure training for your staff and continually remind them of what is considered a breach in your organization. Check out our new webpage. We have lots of good information and lots of videos. Everything from omnibus rule to meaningful use to vetting and contract strategy. Lots of good information about how to keep your organization successful.